Welcome to our exploration of toxicology and environmental health. Toxicology is the scientific study of the adverse effects of chemicals on living organisms. It plays a crucial role in understanding how substances in our environment can impact our health. Environmental health, on the other hand, focuses on the interactions between people and their environment, promoting well-being and preventing disease. In this video, we'll uncover the basics of toxicology, examine real-world examples, and discuss how environmental health professionals work to keep us safe. Let's begin our journey into this fascinating and vital field. Toxin is any substance that can cause harm to living organisms. These can be naturally occurring, like snake venom or plant alkaloids, or man-made, such as industrial chemicals and pesticides. Understanding what makes a substance toxic is essential in toxicology. The dose or amount of exposure often determines whether a substance acts as a poison. Even water can be toxic in excessive amounts. Toxicologists study how toxins enter the body, how they move through biological systems, and what effects they cause. This knowledge helps us manage risks and protect both people and the environment. Toxins can enter our bodies in several ways: through inhalation, ingestion, or skin contact. For example, breathing polluted air, drinking contaminated water, or touching hazardous chemicals are all common routes of exposure. Each route affects how quickly and severely a toxin can impact our health. Toxicologists analyze these pathways to assess risks and develop strategies to minimize exposure. By understanding how toxins travel, we can better protect ourselves and our communities from harmful substances in our environment. One of the core principles in toxicology is the dose-response relationship. This concept explains how the amount of a substance or dose relates to the severity of its toxic effect. Small doses may have little or no effect, while larger doses can be harmful or even fatal. Toxicologists use dose-response data to set safety limits for chemicals in our environment. This helps regulatory agencies determine safe levels for drinking water, air quality, and food additives, ensuring public health is protected. Exposure to toxins can be acute or chronic. Acute exposure happens over a short period, often resulting in immediate symptoms like nausea or dizziness. Chronic exposure occurs over a longer time, sometimes leading to serious health problems such as cancer or organ damage. Understanding the difference between these types of exposure helps toxicologists and health professionals design better prevention and treatment strategies. By recognizing the risks associated with both acute and chronic exposures, we can take steps to reduce harm in our daily lives. Environmental health is a branch of public health that focuses on the relationships between people and their environment. It aims to promote human health and well-being by identifying and controlling environmental factors that can potentially affect health. This includes air and water quality, food safety, and exposure to hazardous substances. Environmental health professionals work to prevent disease and create healthier communities by monitoring, regulating, and educating the public about environmental risks. Air pollution is a major environmental health concern. It is caused by emissions from vehicles, factories, and other sources that release harmful substances into the air. Pollutants like particulate matter, ozone, and nitrogen dioxide can cause respiratory problems, heart disease, and other health issues. Environmental health experts monitor air quality and develop policies to reduce pollution, helping to protect vulnerable populations such as children and the elderly. Clean water is essential for life, but water sources can be contaminated by chemicals, pathogens, or heavy metals. Drinking polluted water can lead to diseases like cholera, lead poisoning, and other serious health problems. Environmental health professionals test water quality, enforce regulations, and educate the public about safe water practices. Their work ensures that communities have access to safe, clean water for drinking, cooking, and hygiene. Soil can become contaminated by pesticides, industrial waste, or leaking underground storage tanks. These pollutants can enter the food chain, affecting crops and livestock and ultimately human health. Environmental health specialists monitor soil quality and recommend safe agricultural practices to reduce contamination. By managing soil health, we help protect our food supply and prevent harmful exposures. Many everyday products, such as cleaning agents, paints, and pesticides, contain chemicals that can be hazardous if not used properly. Accidental exposure can cause poisoning, burns, or respiratory problems. Toxicologists study these risks and provide guidelines for safe use and storage. By following safety instructions and keeping chemicals out of reach of children, we can prevent many household accidents. Pesticides are used to control pests in agriculture and homes, but they can also pose health risks to humans and animals. Exposure to pesticides can cause acute symptoms like headaches or nausea, and long-term exposure may increase the risk of cancer or neurological disorders. Environmental health professionals monitor pesticide use and promote safer alternatives to protect both people and the environment. Heavy metals like lead, mercury, and arsenic are naturally occurring but can become concentrated through industrial activities. These metals are toxic even at low levels and can cause serious health effects, especially in children. Toxicologists study how heavy metals accumulate in the body and develop strategies to reduce exposure, such as removing lead from paint and gasoline. Not all environmental hazards are chemical. Biological hazards include bacteria, viruses, and parasites that can contaminate air, water, or food. These organisms can cause diseases ranging from mild stomach upset to life-threatening infections. Environmental health professionals work to control these hazards through sanitation, vaccination, and public education. Radiation can come from natural sources like the sun, or from human activities such as medical imaging and nuclear power. While some exposure is unavoidable, high levels can damage cells and increase cancer risk. Environmental health experts monitor radiation levels and establish guidelines to keep exposure within safe limits. Certain groups, such as children, pregnant women, and the elderly, are more vulnerable to environmental hazards. Their bodies may be more sensitive to toxins, or they may have less ability to avoid exposure. Environmental health professionals focus on protecting these populations by setting stricter safety standards and providing targeted education. Many people are exposed to hazardous substances at work, from factory workers handling chemicals to healthcare staff exposed to infectious agents. Occupational toxicology studies these risks and develops guidelines to keep workers safe. Personal protective equipment, proper ventilation, and safety training are all important measures in reducing workplace exposures. Risk assessment is a systematic process used to evaluate the potential health effects of exposure to environmental hazards. It involves identifying hazards, assessing exposure, and estimating the likelihood of adverse effects. This process helps policymakers set regulations and prioritize resources to protect public health. Various government agencies are responsible for regulating environmental hazards. In the United States, the Environmental Protection Agency, EPA, sets standards for air and water quality, while the Food and Drug Administration, FDA, oversees food safety. These agencies use scientific evidence to develop rules that protect public health and the environment. Monitoring the environment is essential for detecting hazards and tracking trends over time. Scientists collect samples of air, water, and soil to measure levels of pollutants. This data helps identify problems early and evaluate the effectiveness of regulations and interventions. Biomonitoring involves measuring chemicals or their effects in people, such as testing blood or urine samples. This approach provides direct evidence of exposure and helps identify populations at risk. Biomonitoring data is used to improve public health policies and target interventions where they are needed most. Environmental justice is the fair treatment and involvement of all people in environmental decision-making. Some communities, often low-income or minority populations, face higher risks from pollution and hazardous waste. Advocates work to ensure everyone has equal protection from environmental hazards and access to a healthy environment. Climate change is altering our environment in profound ways, affecting air quality, water resources, and the spread of diseases. Rising temperatures can worsen pollution and increase the frequency of extreme weather events. Environmental health professionals are working to understand and address these new challenges to protect communities worldwide. New chemicals and materials such as pharmaceuticals and microplastics are being detected in the environment. These emerging contaminants may pose risks that are not yet fully understood. Toxicologists and environmental health experts are actively researching these substances to assess their potential impacts and develop strategies for safe management. Food can be contaminated by chemicals, pathogens, or environmental pollutants at any stage from farm to table. Ensuring food safety involves monitoring for contaminants, enforcing regulations, and educating producers and consumers. Safe food practices help prevent illness and protect public health. Individuals can take steps to reduce their exposure to environmental hazards. Simple actions like using water filters, ventilating homes, and wearing protective gear at work can make a big difference. Staying informed about local environmental issues also empowers people to make safer choices for themselves and their families. Communities play a vital role in promoting environmental health. Local groups can organize cleanup events, advocate for better regulations, and educate neighbors about risks. Working together, communities can create healthier environments and influence policy changes that benefit everyone. Prevention is at the heart of toxicology and environmental health. Strategies include reducing the use of hazardous chemicals, improving waste management, and promoting sustainable practices. Prevention not only protects health but also saves resources and reduces the burden on healthcare systems. Education is a powerful tool in environmental health. By raising awareness about risks and safe practices, we empower individuals and communities to make informed decisions. Schools, media, and public health campaigns all play a role in spreading important messages about environmental safety. The field of toxicology and environmental health is constantly evolving. Advances in technology, such as improved detection methods and data analysis, are helping scientists identify new hazards and develop better solutions. Collaboration between researchers, policymakers, and the public will be essential for addressing future challenges. Toxicology and environmental health are vital for understanding and managing the risks posed by chemicals and other hazards in our environment. By studying how substances affect living organisms and promoting safer practices, we can protect our health and create a safer, more sustainable world. Thank you for joining us on this journey through toxicology and environmental health.